Hi everyone. When managing musculoskeletal disorders, pharmacologic therapy is important, but it should rarely be the only approach unless, of course, that's what the patient wants, in which case we support their right to choose their path after informing them of their choices and advice for what might be a better option. Comprehensive care includes alternative and complementary modalities that help improve function, reduce pain, and sometimes decrease reliance on medications. One important non-pharmacologic intervention is physical therapy and structured exercise. Strengthening and stretching programs have been shown to improve joint stability, mobility, and aid in long-term pain control. In conditions like osteoarthritis, combining NSAIDs with exercise often leads to better outcomes than medication alone. Another option includes topical therapies such as topical NSAIDs or capsaicin cream. These provide localized pain relief with significantly less systemic absorption compared to oral NSAIDs. This is especially beneficial in older adults or patients who are at risk for GI bleeding or renal impairment. From a naturopathic perspective, some patients use supplements such as omega-3 fatty acids, turmeric, glucosamine, and chondroitin. While evidence is mixed, omega-3s may reduce inflammatory mediators in conditions like rheumatoid arthritis, and some patients report symptomatic improvement with joint supplements. It is important to evaluate safety, drug interactions, and realistic expectations when discussing these options. Reflecting on this course, one of my biggest takeaways is the importance of individualized pharmacologic therapy. Safe prescribing requires consideration of age, renal and hepatic function, comorbidities, and risk factors. It's not just about choosing the right drug, but also the correct dose, frequency, and appropriate monitoring. For example, if an older adult with osteoarthritis is prescribed ibuprofen 800 milligrams 3 times daily and later develops elevated creatinine levels, a specific and appropriate change would be to discontinue the high-dose oral NSAID and transition to topical diclofenac gel. This adjustment reduces systemic exposure and protects kidney function while still providing effective pain control. Overall, this course has strengthened my understanding of medication safety, monitoring opioid stewardship, and integrating non-pharmacologic strategies into treatment plans. Moving forward, I will apply this knowledge to provide patient-centered, evidence-based care that balances effectiveness with safety.